So we start with some passive work for gastroc and soleus, so taking a stretch on the skin with the hand and then using the tool above their supporting hand. And then here is some passive STR work, so taking the foot into dorsiflexion and using the tool at the same time. And here is a more specific look at around the Achilles tendon. So we can work in the medial or the lateral side of the Achilles tendon. And again, same thing with the soft tissue release, passive or active. And then using your knee as a supporting lever, a supporting base for the ankle. Here is just another angle of working into the Achilles. So with the client prone, foot off the couch, and then you're behind the client. And again, you can do the same thing. So passive STR and also active STR, and also your METs in this position also. And into a standing position from here, so you can work on the front foot, working into dorsi and plantar flexion, so working into the dorsum of the foot and the anterior ankle. You can also work into the posterior ankle, same thing, so foot into anti and dorsiflexion as you're using the tool around the back of the ankle. You can also come into a side on position, so into a Cossack or a side lunge, doing the same thing around the posterior ankle and also the anterior ankle. And then we can add a little bit more movement, so loading the movement, and this is in the frontal plane. So you can do this in all planes of motion, but we're going to focus on the frontal plane here. So taking the leg across, so loading that tissue as you come into that side lunge position. And then finally, we can add a little bit of load and added resistance, so taking the resistance band around the distal shin, and then from there, taking the foot into dorsi and plantar flexion.